This episode of Common Health is brought to you by Reg Lantern. Reg Lantern is a straightforward and easily understandable software platform built to assist community health centers in staying compliant so they can focus on serving their patients rather than paperwork. For health centers that are serious about achieving, managing, and maintaining compliance, Reg Lantern provides a comprehensive approach and is an affordable and valuable solution. Reg Lantern can help your health center. Contact them today at reglantern.com. That's REG, as in regulations, lantern.com. For special discounts, mention that you heard about Reg Lantern on the Common Health podcast.
Hello, and welcome to Common Health from the Virginia Community Healthcare Association, or VCHA, or what we're also known as is VACHA. I'm Tracy Douglas, VACHA's Chief Executive Officer. On Common Health, we're amplifying the voices of community health, both those who give care and those who need it. We are very excited because, as you all know, we try and bring you some of the best individuals who are really trying to make a difference here in the Commonwealth of Virginia. And we hope that the information that we're sharing with you, you're able to take wherever you are in this world. You're able to take this information and use it to bring to your communities as we do here in the state of Virginia. That being said, today we are going to be talking about an initiative that's been going on here for a little while, and it's called the Drinking Water Initiative. And we have an individual here who has been leading the effort here in the Commonwealth of Virginia on this Drinking Water Initiative. And actually, she's such an interesting person because not only has she been really pushing good drinking water here in the state of Virginia, but she did something pretty amazing as well. And that is working with our state so that we could get adults to be covered for dental services under the state Medicaid program. So we feel very, very blessed that we were able to snatch her up to talk about this initiative, this other initiative that she's working on. And that said, we've got Sarah Holland here. She is the CEO of Virginia Health Catalyst. And I have had a chance to get to know her a little bit. And let me tell you, she is really moving and shaking here. And I'm just very fortunate to know her. So hello, Sarah.
Well, hi. Thank you for having me today.
No, thank you. So Sarah, talk to us a little bit about you and Virginia Health Catalyst. What exactly does Virginia Health Catalyst do?
Well, you actually, I think, had the perfect segue in talking about drinking water and also talking about oral health and dental in the intro, because I think that helps to explain the breadth of the work that Virginia Health Catalyst does. We are a statewide public health nonprofit, and our mission is to ensure that everyone in the Commonwealth has equitable access to comprehensive health care writ large. We also have a special focus on oral health. Many years ago, we were known as the Virginia Oral Health Coalition, and we were very specifically focused on, frankly, getting butts in seats. We wanted people in dental chairs, and realized pretty early on that it just wasn't as simple as that. There were a lot of confounding factors. And because of the interrelationship between oral health and everything, we really needed to be thinking about the whole person. So much of our focus at Catalyst is on policy or programmatic initiatives that help people be healthier. Whether that is looking at coverage in the state Medicaid program, so ensuring that if I'm a Medicaid member, I can take care of my eyes, I can take care of my teeth, I can take care of every aspect of my body to make sure that I have the ability to be healthy. Whether that's working with our clinical partners, which are your members, to help them integrate social determinative health screenings into their dental program, or making sure that their OBGYN services are ensuring that those patients are getting seen by the dental team as well. So initially our work was very focused in that healthcare sphere. A big piece of that was also water fluoridation. We wanted to make sure that enough people in the Commonwealth had access to fluoridated water. And we're really lucky here in that almost 100% of our public water, so the water that's coming from our tap, if you are with a public system, is fluoridated, which is one of the highest in the nation, very enviable. And if you all don't know, which I hope everyone knows who's listening to this, fluoride is one of the least expensive and most effective preventive modalities to stop cavities. It decreases cavities by nearly a quarter, and it makes all of us healthy, and it is super easy to access. We started to realize as we were working with our public policy folks to make sure that the water in Virginia stayed fluoridated and are very successful, hence the nearly 100% rate of public water systems fluoridated, that fewer and fewer people were actually drinking their water. So it didn't really matter if we were protecting water fluoridation in the Commonwealth if folks weren't drinking it. And we also started to have a better understanding of the fact that there are a lot of people in the state that are accessing their water through private sources like wells, and their access to water fluoridation is very different. Fluoride is a naturally occurring mineral, so some folks are going to be lucky and they're going to have optimally fluoridated water naturally. Others could potentially have too much fluoride, which is an issue that also needs to be rectified. The majority of folks who are on well water don't have enough fluoride and need to either supplement their water or work with their doctor to have some kind of supplementation to make sure that they're accessing, again, what is a really inexpensive and effective modality.
So with that said, where do we find those who have access to like regular drinking water, like you were saying, that's not well water, right? Where do you find that mostly? And then where do you find individuals who are mostly only accessing well water?
So the majority, and I am generalizing, but the majority of folks that are in urban and suburban areas are going to be on public water systems that they're accessing through their county or some other type of locality, or Fairfax water system, or whatever that might look like. Often it's the rural areas that are getting their water through well sources.
So then do we know in some of the rural areas where there is little fluoride access or too much fluoride access? Do we have any idea of where that is, and then what are we doing about that?
So that is, in many ways, the $1 million question. We generally know where in Virginia there is optimal fluoride, where there might be too much fluoride. Those are things that we generally know through working with our scientist friends and our geography friends. We don't know at the source, in that there's not mandatory testing if you have a well. You are required to test your well when it is built, and that is it. So you could be drinking from a well every day and not know what's in your water. And there aren't regulations surrounding fluoride or really anything regarding that testing. So while we have some anecdotal information and some really good qualitative data coming from folks at Virginia Tech and some of the other great academic groups that are working on this, Cooperative Extension is a really active partner in this space, we don't have foolproof data like we might have if we're working with a public water system.
So what do we do about that in the rural area? Because as you know, our organization works with many community health centers that are located in these rural areas. And some of these community health centers are able to provide dental services. And as we know from our data, we're not seeing good dental compliance, right? And so that being said, and hearing from you about the importance of having access to fluorinated water, how can we get the message out there to folks?
Well, you all are truly the perfect people to be doing that, because you're trusted in your community and because you have an opportunity to have those conversations. And it doesn't need to happen just with the dental team. I think that we, as as trusted folks in the community, can talk about the importance of water fluoridation and the importance of water writ large, because it isn't just fluoride. We don't just want people to drink water because of fluoride. It's sort of the angle that Virginia Health Catalyst got in there. But it's definitely not the only reason. And I think as folks come in for their well child visits with their kids, or come in for their own either primary care visits, or if they are there for an ongoing chronic issue, there's an opportunity for a community health worker, for a nurse, for a physician, for really anyone who is coming in contact with that patient, to ask them, like, do you know what your water source is? And if it is on a public water system, then you'll be able to tell them whether or not it's fluoridated, and certainly really encourage them to drink that. If they are telling you that they're in a well, if they're getting their water from a well, you can talk with them about the importance of fluoridation. You can understand your community and know the likelihood of whether or not that water is fluoridated, and talk with them about the benefits of that. I think another thing that you all can really help with, there is a misnomer that bottled water is safer and better. Bottled water is less regulated, more likely to be acidic, so harm the teeth, and 300 times more expensive than your tap water. And we also know, so those are facts, they are marketed, bottled water is marketed so heavily to low income communities. They prey on issues related to trust. Do what's best for your family, do what's safest for your family, do what's healthiest for your family, and make sure they drink this bottled water. When the safest, best thing for them to do for their family is to pull that water from the tap and hand it to them in a cup. And you all can share that information. You can say, you know what, bottled water is actually less regulated than what's in your tap. And it's also a lot more expensive. And if you do have dental issues, it's very likely not fluoridated, and it's also pretty high chance that it's more acidic and could be causing more dental problems than it's helping. That's not a message people hear very often.
Right. Yeah. I mean, when you just saying that to me really kind of raised a red flag for me, really, opened my eyes to what you're saying. So then on the flip side, what is the misinformation that's out there about fluorinated water?
Well, there is a significant amount of misinformation about fluoridated water. Let me first start with what is true about fluoridated water, and what I want to make sure that is heard. Because I heard one time that if you say too often the misinformation, even if you're trying to debunk it, people hear the misinformation still and it can be spread. So I'm going to lead with what is true about fluoride. Fluoride is a naturally occurring mineral. Grand Rapids, Michigan started fluoridating their water in 1945. So that was a really long time ago. 1945, Grand Rapids, Michigan began to fluoridate their water because science showed that areas where water was naturally fluoridated, people had less tooth decay. Science showed that over years and years.
Wow.
So in 1945, which again was a very long time ago, Grand Rapids, Michigan started fluoridating. In Virginia, our first locality started fluoridating in 1951. So not very long after. And we have had water fluoridation across the state, across the Commonwealth since that time. So 1951, long time ago. Since that time, we've seen a decrease in cavities. We've seen healthier mouth and healthier people. And you can make that tie to fluoridated communities. When you're looking at communities that don't have optimally fluoridated water, their dental disease is higher and their dental decay is higher. Those are facts. It is a naturally occurring mineral. Water systems can adjust the level of fluoridation using that naturally occurring mineral so that it reaches the 0.7 threshold, which is the optimally occurring kind of CDC language for what makes it so that you and I can be drinking fluoridated water that is appropriate. But some of our friends don't have fluoridated water, don't have fluoride added to their water system because it's already naturally occurring, and their benefits are exactly the same. So I just want to be really clear that it is a naturally occurring, safe additive to water that has been happening in the United States for well over 50 years, nearly 100 years.
So when I think about growing up, okay, Now, even though I claim that I'm in the 20-ish realm, okay, don't let the gray hair fool you, okay? But I can remember growing up, we didn't have bottled water, right? We had to go and we were drinking water out of the hose, yeah. Right? Yeah. Running in the house real quick from playing and going to the sink, the kitchen sink, and getting water. How did we lose that?
I think marketing is really powerful and money is really powerful. And we have, organizations and groups and companies that are spending a lot of time wanting us to believe that the better choice is something that we purchase separately from our tap water. And I would be really remiss if I didn't also point out that there have been some significant problems with the public water system as well that have understandably really led to some trust problems. Flint, Michigan, just say that, Flint, Michigan, and everybody knows what I'm talking about. That community is irreparably harmed because of really, really, really poor decisions and failures in that public water system when they were making some what should have been relatively simple adjustments. And candidly, when we at Catalyst started to get smart about water and started to better understand water systems, when you realize the failures at Flint, and there have been similar failures in Washington, D.C. and other parts of the country, it's certainly not exclusive to Flint, you realize how important that trust piece is, and that once it's lost, it is really difficult to get it back. Because when you're thinking about the health of your family and somebody's saying, but in Flint, there was lead. How do I know there's not lead here? Or I don't like the way my water tastes, or sometimes my water's brown. Rather than trying to understand what the sources of that might be, you're going to choose to drink other things. And it's hard to argue with that when you're trying to protect your family.
So what do we say to our policymakers?
One, they need to invest. I think that we should all feel really good about the Bipartisan Infrastructure Act that passed through Congress. It is bringing millions, hundreds of millions of dollars into Virginia that is going to help us upgrade our pipes. It's going to help us swap out all of those lead pipes, which is something we've been trying to do incrementally, but it is incredibly expensive. Infrastructure is very costly, and we don't see it. So it can be really easy to not invest what you're not seeing. And those investments are incredibly important. And we need to make sure that our policymakers, both federally and at the state level, are watching that and are making sure that they're prioritizing those investments so that something like what happened in Flint doesn't happen here.
So are we testing? So we know that there is significant amount of dollars coming into the state, but with the infrastructure funding that came through. But do we have some benchmarks, right? Do we know where we are today, right? And where we want to go with these investment dollars?
Yes, I think we do. I think again, thinking about the infrastructure and sort of the silent partners, our state Office of Drinking Water is amazing.
There's a state office of drinking water,
and they're amazing. And they do a phenomenal job of protecting us. We have among the safest water in the country. Let me say that again. Virginia has among the safest water in the country. It's pretty amazing. And it's because people at the Office of Drinking Water care and are diligent about making sure that as federal investments come in, they are being allocated appropriately. They are also looking very diligently there's massive amounts of money that are coming in right now. And we have a responsibility to make sure that that money is going to the communities that most need it.
Right.
Often those are the communities that have the most difficulty spending it because they're smaller water systems. They don't necessarily have the infrastructure to take on big capital projects. And that's where the organization at the Office of Drinking Water comes in really handy, because they can help and make sure that those investments are well utilized, and that some of the smaller utilities or smaller programs have the tools that they need to, one, apply for the money if it's money that they need to apply for, and be able to utilize the money as it comes in, which is really important. And that's a that's an eagle eye that we need and that is really easy to forget to look for.
So how can the communities get involved to ensure that their community is not forgotten?
Yeah, they should ask their pediatrician, what's my water? Their pediatrician might not know, but if people are asking, they will certainly want to find out. Absolutely, they can call their water systems to learn more there. There is a publication called the Consumer Confidence Report that every water utility is required to make available annually to their subscribers to let them know what is in their water, essentially let them know that their water is safe. I will let you know that it is not the easiest publication to read. It is written at a very high literacy level. There are very significant requirements from the EPA about what has to be in it, which can make it really difficult to read. I offer that because I think that it's important to know that your water utility can be hamstrung in the way that it is mandated to communicate with you, but that doesn't mean that they can't also communicate with you in other ways and answer your questions in ways that you can understand.
Right.
One of the things that we're doing at Catalyst, and one of the things that our Water Equity Task Force initiative is taking very seriously and trying to spread, is assistance with our utility partners on communication. They are not skilled in how to communicate about water with the community.
Right.
And we don't want them to be. We want them to be really good engineers and really good scientists and really good at keeping our water safe. And it also is something that is really important for the community to be able to understand what's in their water. So we're providing tools and resources to help the water utilities be able to communicate with their customers and also with their broader community in a way that's different from the CCR, so that they can, which they're still mandated to put out, so that they can say, your water is among the safest in the country, and you should feel really proud of that. And you know what? If maybe your water tastes a little chlorine-y, a water scientist right now is freaking out that I said chlorine, but you know what I mean. Sometimes you taste your water and you're just like, it doesn't taste as good. Yeah. Did it rain the day before? Was there a runoff maybe? And so there's more dirt in the water that needs to be cleaned out. Like you start to think about that and you're like, so that's actually a good thing. Like the fact that, when you look at your CCR, I will confess it can be really scary. It says, there's X number of chlorine in your water. And you think, well, I'm not drinking this. I don't want chlorine in my water. Well, do you want E. coli? Because I don't think you want E. coli, and the chlorine is killing the E. coli.
Right.
So you actually do want additives in your water. You just want a really smart person managing that. And we have that in Virginia.
So what is the Virginia Household Water Quality Program? Is that coming out of the Office of Drinking Water here in the Commonwealth? Or?
So that is an Office of Drinking Water program. The Water Equity Task Force is what the Virginia Health Catalyst is convening. And that group is putting together policy and programmatic recommendations for the Commonwealth to ensure that our water is safe, that it's trusted, that it's fluoridated, and that it's preferred. So that it's what people are drinking. And I think it's that last piece. If we can get the front pieces right, we still have to work on that trust piece. And I think that's where your members and anybody who's listening today they're the most important piece of that puzzle, and helping, one, making sure you understand what's in your water, and then sharing that. And if you're somebody that convenes a lot of meetings, start serving tap water. Get a Brita filter or get a pitcher and start serving tap water, and explain why you're serving tap water.
Yes. So talking about our membership, federally qualified health centers and community health centers, free clinics, rural health centers, all of that, not just here in the Commonwealth, but also throughout the country, we certainly have some of the expert infrastructure. I'm going to say the infrastructure. We have outreach infrastructure, right? So I could really see us utilizing our outreach workers, right? And having some of those conversations with our communities, because those folks are really out there, right? Connecting with their communities. And a lot of our outreach workers and our community health workers are from those communities, right? So they can actually speak to it. So, I'm going to ask you something. You drink tap water?
I do.
You do?
I do.
Were you apprehensive that first time you drank tap water?
Honestly, my family's always had tap water, so there was not a inflection point. We've just always had tap water. We we got a new fridge once, and we got the water filtration thing in the fridge, and I did actually have to do some separate research to that to make sure that wasn't filtering out any of the fluoride or any of the things that were important to me.
So you actually did? Mm-hmm. Oh my God. And I don't do that stuff.
I did. Okay. Yeah. So we drink tap water, and at Catalyst, we drink tap water. We don't have we don't have a water, I don't know what they're called, water cooler dribbler thing. We fill up our water bottles with our good old tap water, which is right across the street from here. So it's the same water that you all have. Yeah.
Uh-oh. I'm now looking into our workplace kitchen, and we have tap water. I mean, no, we have bottled water. We have bottled water in there.
So isn't that a perfect example of a one small change that could have a ripple effect, because you're going to explain why you're doing it.
Right. Why the change? And then, people will say, oh, that's interesting. And if you get feedback that I don't like the way this water tastes, you can go to Target or Walmart or wherever and buy a filter. The Brita filters do not filter out fluoride, but might filter out some of the harsher taste if you don't like the way it tastes. So you're still getting all the benefits of tap water, and you're already paying for your tap water. Right.
Henrico's got some really good water.
So what about, could we do something, and I'm just thinking again, going back to community health centers, with them being literally in the smack middle of some of these communities here, could we host like drinking water clinics? I mean, could we do things like that?
You could do, oh God, Tracy, there's so much you could do. I could give you a very long list. But just thinking right now, I think that particularly for your clinics that are in rural areas where they're likely to have a large percentage of patients that are drinking water that is from wells, we could establish some partnerships with some testing, because I think it's that well water that's really unknown. And because there isn't a requirement for testing, and because testing can be expensive, there's a lot of reasons why folks aren't taking the initiative to get the water tested themselves. So either they're what I've learned from the academics is called a water coping mechanism. If they're concerned that their water is not safe, they're buying bottled water or sugar sweetened beverages instead of drinking the tap water, rather than doing investigation to see if the tap water if there's in fact something wrong with it, which there likely isn't, but it's certainly not something that is known until it's tested. So opportunities to work with organizations that provide low cost testing for patients that are in rural areas. There's also really, I think, wonderful programs that are particularly designed for youth to encourage tap water drinking that the Virginia Foundation for Healthy Youth sponsors, called Rev Your Bev. And they have put together kits for pediatricians and other healthcare professionals to help them get people excited about drinking water. So that's certainly something that you could do. I think that there's also lots of opportunities to help with policy. For instance, if there is an anti-fluoridation campaign in an area where the clinic is, I already know we rely heavily on the expertise of your physicians and your dentists and folks that work there, because again, they're trusted members of the community and they understand the science to talk about the importance of maintaining fluoridation. But we need constant vigilance on that, even while we're trying to make sure that people are drinking the tap water. So there's a lot of ways that your member clinics can be, I think, huge change agents for this, starting with their own clinics. Like, are they serving tap water?
Right.
And also then broadening to how they can impact their patient base as well as the communities that they serve.
So I'm just sitting here thinking, these are some great ideas, and this is definitely something that I think we need to have more conversation about internally, about how we can help promote that with the community health centers, and not just in the Commonwealth, but in other states as well. But, just a little thing too, going back to drinking tap water, we have water fountains, right? And so is it okay for us to drink from those too?
So I'm a big fan of water bottle filling stations, which you can retrofit on a water fountain for relatively low cost. And those are, I don't know if you've seen them, but you just put a water bottle under them and then you can fill them that way. So you're getting the benefit of the filtration, but you're not necessarily putting your mouth on. I mean, I know when you're drinking from a water fountain, you're not supposed to put your mouth on the water fountain, but
exactly. Okay.
So water fountains can be relatively easily retrofit with a water bottle filling station.
Okay.
And then you buy, your employees. In fact, we would be happy to donate all of your employees some Virginia Health Catalyst water bottles. But then you have your water bottle, you fill it up, and it's with you all day.
Okay.
There's a lot of initiatives getting schools retrofitted. I'm not sure I used that language correctly, but making sure that all of their water fountains are turned into water bottle filling stations.
So, Sarah, what is the last thing that you can say to our listeners about this drinking water initiative here in the Commonwealth? What is that message that needs to resonate with them so that they can take this, make some changes within their own circle, their own space, but then also they can spread the word?
Yeah. I think you hit the nail on the head when you said spread the word. I think each of us have an opportunity and a responsibility to talk about water. It's not something that we talk about very often or think about very often, particularly those of us of privilege who are either just buying bottles of waters or filling up their water bottle and not really thinking about it at all. And, we didn't touch a lot on affordability, but there are also folks that can't afford their water. I mean, there's lots of issues. And so I think that to the extent that we can, in the tables where we sit and the rooms where we are, talk about water and think about whether or not the conversation that we're having water could impact either as a health or as an affordability issue, and raise that.
And Sarah, tell me what's next for the Catalyst?
Yeah, well, for our water work, our Water Equity Task Force, we actually just had a meeting this morning where we were really diving into some recommendations around water affordability in Virginia. We are working on a state plan in partnership with, there's about, I believe, 75 different organizations represented on the task force. We will come out with that plan in the fall. And one of the things that I really consider Catalyst's superpower to be is that we don't just do plans and then move on.
Right.
We implement the plans. So we'll be working with our State Office of Drinking Water, hopefully with your members and a lot of other partners across the Commonwealth to make sure that we are moving policy forward and working on some programmatic interventions so that in Virginia, our water is safe, that it is trusted, that it is fluoridated, and most importantly, that it's preferred.
Awesome. Well, Sarah, thank you so much for your time and your energy and your commitment to this program and for educating all of us. And so we hope that we can have you back because we'd love to hear more about some of these current initiatives that you're working on around this safe drinking water initiative. So
love it.
Again, thank you.
Yeah, thank you.
I want to thank my guests for joining us today. And thank you to all the listeners for tuning in to Common Health, brought to you by the Virginia Community Healthcare Association. If you enjoyed this episode and you'd like to help support Common Health, I encourage you to hit the subscribe button, share it with others on social media, leave a rating and review, or visit our website at www.vcha.org. This is Tracy Douglas. Thanks again, and I'll see you next time.